Hello, and welcome to Prisma Health Business Health Solutions COVID and Health Update. I'm Dr. Rachel Brown, the Medical Director of Prevention and Wellness, and I hope all of you had a wonderful, safe, happy, healthy Thanksgiving. I am going to dig right in because I have a lot of information to share with you since the last time we did an update. As many of you know, there are some treatments and some vaccines on the horizon, so I want to spend some time talking about that today. But first, I will do the usual status update, and all of us, I think, are aware that the numbers across the nation are rising, that we are in the middle of a surge. A few weeks ago, South Carolina was one of 8 states that had a percent positive that remained above the 10% mark. We are now one of about 25 states that has a percent positive of COVID cases that's above that 10% mark. So we are seeing a really huge increase in our numbers, sadly. As far as South Carolina is concerned, that percent positive yesterday was 12.7. So of all the folks tested for COVID, 12.7 of them were positive for COVID. On average, over the last 2 to 3 weeks, we've been more around the 13.9, 14% mark. As always, I'll go through a few counties just to give us an idea of what's happening across the state. Richland County is at 295 cases per 100,000. Of course, that keeps them in the high risk category, and that's a small bump from a week ago. Sumter also had a small bump at 298 cases per 100,000, also keeping them in the high risk category. Unfortunately, we're seeing a really big spike in our upstate counties. Greenville had a huge increase and is now at 587 cases per 100,000. And Oconee's numbers have nearly doubled so that they are now at 665 cases per 100,000. So what we suspected during cold and flu season is true. We are seeing a spike as temperatures get cooler and folks are spending more time together indoors. We'll see what happens after the holiday break to see if those numbers go up. Hopefully most of you were able to limit travel and limit gatherings and exposure. So let's talk a little bit about testing right now. We know that there's more testing happening. It's readily available now, so we have a lower threshold for getting folks tested, especially symptomatic folks. Even though we know this is cold and flu season, we're also testing for flu. These symptoms could be caused by allergies and colds, but we're testing most anyone with respiratory symptoms for COVID, which is the right thing to do. I want to talk a little bit about quarantine because the other time we test is when folks have had an exposure to someone who's been diagnosed with COVID. And remember that exposure definition has changed slightly. It is, you are considered a close contact of someone who has been diagnosed with COVID if you were within 6 feet of them with a mask or without a mask for a cumulative period of 15 minutes over 24 hours. So it doesn't have to be 15 minutes all at one time. It can be over a 24-hour period. So that means many more folks are meeting the definition for exposure and many more folks are being tested. You know that the current recommendation is that we test people who feel like they've been exposed at around day 7, and regardless of the result of that test, we recommend that they quarantine for 14 days. But you also may have heard that the CDC is working on refining and changing that recommendation. I would be prepared in the next few days to hear from the CDC that let's test a little bit earlier, maybe around day 3 to 5, and then shorten the quarantine time to 7 days for folks who test negative. This is based on much data, a lot of research, expertise and skills among the people who have been watching this very closely. And so we know that this protocol is likely to be safe and cut down on exposures, but also get folks back into their daily routines sooner. And quite honestly, one of the arguments for changing the recommendation is that that 14-day quarantine period was so onerous that folks weren't observing it anyway. And they felt like as long as it's safe, changing the parameters may help us to be a little bit more compliant and again cause the numbers to drop. So be on the lookout for changes for that recommendation. If you've got an exposure, an employee who's been exposed, testing at 3 to 5 days, and then a quarantine period of 7 days may be around the corner. Let's talk about some exciting treatments that are out there, just so that you're in the know. You may have already heard of them. Of course, remdesivir is one that's very, very popular, has been around for a couple of months. It goes by the trade name Velcluri. And this one is has been shown to be helpful in moderate disease. Okay, so folks who are getting treated with this who may not be as sick as others. Now, they are definitely using it in severe disease as well, but this opens up that treatment to many more folks. But what's exciting is the monoclonal antibody treatment that's out there, and you may have already heard of one called Regeneron. But there's a second one that's gotten emergency use approval. Bear with me, bamlanivimab. Okay, and these monoclonal antibodies mimic our own immune system and will attack the COVID virus like our own immune antibodies would do. And what they have been found to do is lessen the severity of disease in folks with mild to moderate disease. So these are folks who are not needing to be hospitalized, but who can get this treatment as an outpatient. It is an infusion, and recover more quickly from the disease. Now, the U.S. government is distributing these medications based on case load and case numbers in different areas of the states. And so Prisma Health, of course, has applied to have these medications available, and we will begin using some of these medications in the next week or so, which is exciting. Let's talk about vaccines, because everybody wants to know about vaccines. Let's give a little bit of an update. So if you hadn't heard already, Pfizer has completed the requirements for data accumulation of phase 3 trials, and as of November 20th, they have an application in for emergency use authorization of their vaccine. And just today, November 30th, Moderna submitted their application for emergency use authorization. The understanding is that on December 10th, the FDA will give us word about the Pfizer vaccine and whether it's been approved for emergency use authorization. And a week following, on December 17th, we should find out about the Moderna vaccines. Now, let me tell you a little bit about these vaccines. They're both what are called genetic or mRNA vaccines. So they actually involve using genetic material to replicate the virus and the immune response in your body. Both the Pfizer vaccine and the Moderna vaccine have shown to be about 94% effective. They are both difficult to administer because of their storage requirements. So the Pfizer vaccine needs to be in a deep freeze. The Moderna vaccine can be refrigerated, but both of these will cause, logistical concerns in terms of setting up vaccine sites. They're also both 2-dose vaccines. So general recommendations are to come back at 3 weeks to get that booster vaccine. There are a few other vaccines that are in phase 3 trials that we've talked about before. There are a couple of what are called viral vector vaccines. They actually travel in on a virus so that the body recognizes a portion of a virus that does not infect you, but causes that immune response to occur. The Johnson & Johnson vaccine also needs to be refrigerated. They actually are looking at doing, they started their trials with 1 dose. They're looking at a 2-dose trial now to see if that's more effective. AstraZeneca is still working on their phase 3 after a pause, earlier this fall because of a bad outcome. What's interesting is because of an administration error, they originally started with a half potency dose, followed by a full potency dose. And they found that combination actually increased the effectiveness of the vaccine compared to the 2 full potency doses. So that's kind of interesting. There's also Novavax, which is called a protein vaccine, and they're hoping to start a phase 3 trial in the US this month. And then there are numerous other countries that have a limited approval for some other viral and genetic vaccines too that we may see coming. So the way this is going to work, if you haven't heard, is a tiered approach. So that vaccine administration in December and in January, if these vaccines get approved for emergency use, will happen for high-risk groups first. And so that tends to be critical healthcare providers. There also tends to be, will be an emphasis on EMS transport. So first-line healthcare providers will be first. Then they will move to critical infrastructure workers as well as high-risk populations. So folks who maybe are of older age or who have multiple chronic diseases. Then after those folks are vaccinated, they'll move more towards other occupational workers and other risk groups, and then finally to all comers or all folks. Right now, we don't have a vaccine for children. So this will be either older teens or adults, but you should see it happen in a tiered approach. Now, one thing that's important for you as a business, as an organization, to consider is whether you would like to be what's called a closed pod. And pod actually stands for point of dispensing, excuse me. And in this particular case, we're talking about a vaccine, but pods are generally for any medication that may need to be dispensed during a public health emergency. So when an organization becomes a closed pod, they are partnering with DHEC to administer, again, in this case, the COVID vaccine to their employees. And so what this can do is it can allow you to give access to your employees to this vaccine, not necessarily earlier than others, but more easily than maybe having to go to a primary care appointment or through a drive-through, that kind of thing. I'm going to pull up some resources for those of you who may be interested in the closed pod concept. So let me share my screen briefly so that you can take a look at this. So if you go to the CDC's website and look up closed points of dispensing, here's some general information about what this means for you as a business. And if you click here on this preparedness and response capability, national standards, it will give you some videos and some other information about how you can vaccinate your employees or your workforce in partnership with DHEC. But I'd like to show you also this website. And again, this is under vaccines, guidance for planning vaccination clinics held at offsite locations. So these are in locations such as your office building that are not a medical building. And one of the best resources you can have here to see if this is something you're interested in and prepared for is this checklist of best practices for vaccination clinics. So I'm going to pull that checklist up just so you can take a quick look at it. It's pretty extensive, as you might imagine. And so you can look at each one of these elements of shipment, transport, storage, do you have clinic space, and so on, to see if maybe you could accommodate being a closed pod for your organization. Now, I will say that while this does look pretty daunting, this is something that you would do in conjunction and in collaboration with us at Prisma Health and with DHEC. We will be having a webinar, hopefully on December 14th, that will go through this process. We hope to have a guest from DHEC join so that she can talk to you about what it means to become a closed pod, and I will talk to you about that as well. In the meantime, while we're still here, I'd like to show you this page. Remember that our Prisma Health Creating a Safer Work Now It's Safer and Healthier Workplace has a button that you can use to contact me. If you'd like to speak with our team or schedule a call with me to talk more about closed pods, about quarantining exposures, about the vaccines in general, please click this button. And of course, there's plenty of other information on this website that answer some of the frequently asked questions that you may have. So I'm going to stop sharing my screen for just a moment. All right, so we've talked a lot about some changing recommendations. We've talked about some new treatments coming down the pike, and we've talked a little bit about vaccines, and maybe your organization is interested in becoming a closed point of dispensing or a closed pod. So please reach out to us or try to attend our live webinar where you'll be able to ask questions in a few weeks. Look for information about that. Now, I want to end, as always, on a health topic and just give you a few tips for our holiday health hack on how to maintain your weight over the holidays. So what I call freedom from the fruitcake. Now, I recommend to folks that this is not a time to lose weight, and especially this year when we're under a lot of stress, and the holidays may mean more than ever to some of us. And some of those traditions that we like to celebrate are the different foods that we eat. But it is possible to maintain your weight over the holidays. So let me give you a couple of tips. First of all, do not skip meals, okay? This is not a healthy way to try to lose weight. Your body actually will overcompensate and store fat, as well as have peaks and troughs in your insulin levels, which do nothing to help you, especially if you happen to be a diabetic. However, you can alternate light and heavy meals if you feel better about that. So for instance, a light breakfast, heavy lunch, light dinner, heavy breakfast the next day, light lunch, heavy dinner, back to light breakfast. You can do that, and that really helps to even out your insulin levels, and your body will not feel like it's starving. The other thing here that's key is portion control. So I tell folks, try everything that you love over the holidays, whatever those favorite treats are, but just do it in moderation. Just keep the portion small. Try a taste, okay? Certainly don't sit there with the bag in front of you or the plate in front of you. Just try a taste of it. Also think about what you're drinking. This can sneak up on us as well. So anything sugary that you're drinking, so whether that's a cocktail or sweet tea or sodas, those are empty calories, and that will accumulate more quickly than anything. So the best way to distract yourself from those cravings that you have, if you're finding that moderation is trouble for you, is holiday fun. So what you have to understand is that when you are doing something other than eating that releases endorphins and causes you to feel good, whatever those holiday traditions are, whether that's putting together a puzzle with your family, caroling, having a FaceTime chat with a family member, whatever that is, that will actually increase your endorphins to reduce those cravings. And more importantly, it will reduce your cortisol, which is your stress hormone. And of course, that is sky high right now in everybody. Now, you have heard us say over and over again that really avoiding big holiday gatherings and eating out is a good idea right now. However, if you do find yourself attending, say, very safe, socially distanced outdoor parties, they're going to have some great food there as usual. And one way to manage that is to make sure you've had, say, a full glass of water or even a protein snack before you head off to these events. That will make you feel more full. The protein makes you feel more satiated or satisfied. And so you can taste each one of your favorite things without feeling like you really need to shovel it in. Two really interesting studies found some cool things that can help us decrease our intake when we're at parties. And the first one is the farther you stay away from the food. Okay, so if you choose a table that's away from the food or the kitchen, you tend to do better. And also how tight fitting our clothes are. So the tighter fitting your skirt or your pants or your outfit, the less you tend to eat while you're out. So you can keep those eating pants at home. Let me end by giving you a couple of swaps or a couple of holiday treat ideas that are a little healthier than the typical treats that we see out there. And the first is anything wrapped in bacon If you swap out prosciutto, you can get similar taste, but have much less fat intake. I will tell you that one of our favorite things around here is to take a piece of mango or melon and wrap it in prosciutto. You can add arugula, you can add spices to that, but that's really, really healthy for you. Lots of folks will have coconut shrimp or popcorn shrimp. If you just have regular shrimp and without frying it, that's a way to have that taste without the heavy calories. And then finally, when we're talking about cookies, there are ways to have sweets in a little bit healthier way. And the first is choose non-frosted sugar cookies, for instance, or non-sugared sugar cookies. You can try meringue cookies instead of regular flour cookies. They tend to have less calories. But a couple of other recipes I want to share with you that I've seen and had from folks that have brought these to holiday parties. A cucumber slice with a little bit of smoked salmon on the top and a dollop of sour cream, a little bit of dill. That's an amazing treat, very low calorie. The other one that is a favorite of my mother's is to take mushrooms, scoop out the center, put a little bit of crumbled ground sausage in there with a breadcrumb mixture, and then broil that. So for those of you who love stuffed mushrooms, this is a great way to go. So you can tell all you got to do is take some of those typical holiday treats, tweak them a little bit, make them a little bit healthier for you so that you can keep off that extra weight that we're already fighting to keep off because of the excess stress hormone cortisol that we all have in our bodies. So I hope this information was useful to you. Again, join us each week. I'll have a new update. There should be a live webinar coming up soon where you can ask questions about COVID or holiday health hacks. In the meantime, use that contact button to reach out to my team, and have a great day.